Today I'm going to show you how to request authorization for a patient that requires pre-authorization. There are certain insurance companies that will require pre-authorization. In order to check that, you can go under the authorization tab in the patient's chart to see if they require authorization. If they don't, it will say in red letters here at the top, patient does not require authorization, and you can enter your frequency request without any authorization request. If they do require authorization, you'll see a box of active authorization down here. It will look like this. It will show you the discipline, how many visits they have, how many haven't been used. After you've done your evaluation of the patient, you can decide if the visits they have are enough. Oftentimes we'll only get 1 or 2 visits and will require additional to treat the patient appropriately. So in this case, we have 2 visits. I'm going to suggest the patient needs at least 8 visits, so we'll have to enter that request. I'm going to go down here to add new auth request. So the authorization request will start looking like this. We'll say add new request. Okay. Next, we're going to choose our discipline and the frequency or the period that we're requesting that authorization for. So for me, I'm PT. I'm going to request 7 additional visits. 6 additional visits. We already have 2. And I'm going to click continue. This is what the authorization request form will look like. It'll say Managed Care Assessment at the top. And we'll go ahead and get started. So first is this box with basic information. Enter their physician, diagnosis, date of assessment, enter their vital signs that they had at your visit, again you're going to select your discipline and how many visits. Now you're usually going to be requesting authorization for your own discipline. However, there may be cases where you need to request for a different discipline. So if you're a PT and you think the patient needs an OT evaluation or a nursing evaluation, you can enter an auth request for them. Just keep in mind you can't request more than 1 visit for another discipline for their evaluation. Then they'll have to add a new request for any additional visits they need. So I'm going to enter twice a week for 3 weeks. Pending auth. I write that because sometimes if we get the authorization in the middle of the week and we don't have room to see them for 2 visits, we can adjust that frequency maybe to be 1 week 1, 2 week 2, 1 week 1. Again, we're going to put in the date range. Okay. You can skip the social security number most of the time. You can skip who you spoke with at the physician office unless it is a frequency or an insurance company that requires you to get a verbal order before requesting authorization. Unless you are requesting a nursing evaluation, you can skip the nursing assessment altogether, and then you'll see the box toward the bottom for the therapy assessment. So you're going to generally just give an overview of how the patient's doing, their prior level, their current level, description of patient's mobility, any kind of standardized test. I use the Tinetti often, but you could use any test related to balance. Sometimes I will clarify what this score means. I consider this kind of our argument for why the patient needs additional visits. So finally, at the bottom, additional info as to why patient needs these visits. Okay, so this is, I think of as my last appeal. So the patient requires skilled PT to address gait balance strengthening to reduce risk of fall and improve safety and independence at home. The patient reports her goal is to return to being independent and attending silver sneakers classes. Patient is a high risk of fall and requires continued education and training. So we're trying to make an appeal of, why would this be important to the patient and why is it important to the insurance company? They don't want the patient to fall. They don't want the patient to go back to the hospital. And obviously we want to include the patient's personal goal because that's what's important to the patient and why we're seeing them. And then I'm going to sign it and date it. And I'm going to go back to the top and I'm going to save that assessment. Close out of it, and you'll notice now it will be under the authorization request box. It will say not processed. You don't need to reach out to anybody. This will be handled by the office. They will get that request processed. You can come and check the status of it as you go. You'll see some notes here about when it was faxed. You'll get a message once those visits are received, whether you get the whole amount or a partial amount, and then those will be plotted on the schedule for the patient. You can always view the form that was entered by clicking view. You can go back in and that is how you complete an authorization request.